What's up, everyone? Welcome to the Quadcast, the show where we get real, get raw, and get loud about mental health, substance use, and the fight to take our lives back.
Each episode, we're cutting through the stigma, dropping knowledge, sharing stories, and bringing the heat with guests who have lived it and aren't afraid to talk about it.
So turn it up, lock in, and let's break barriers, spark change, and build a community that refuses to stay silent. You're tuned into the Quadcast, and let's get into it.
You can find us on Patreon, Facebook, Instagram, or email us. The Quadcast is always looking for new guests, whether you're individuals that have experienced it, you're in law enforcement, treatment programs, nurses, doctors, or anyone that just has something to say. Come share your story with us on mental health or substance abuse.
Warning, there's cussing in this video. If you don't like swear words, well, you're
watching the wrong damn show.
All right, for episode 2 of season 2 of the Quadcast Podcast, we're excited to welcome Taylor Lusk. Taylor has a background in both education and nursing, holding a bachelor's in emergency services and an associate degree in nursing. Taylor is a registered nurse with specialized certifications as sexual assault nurse examiner for adults and adolescents, a forensic nurse examiner, and a National Registry Paramedic. With experience that bridges education, healthcare, forensic practice, Taylor brings a thoughtful and grounded perspective to today's conversation. We're really glad to have Taylor on with us today. And Taylor, if you want to introduce yourself and give us some of your background and what you do currently, and then we'll get into it.
Perfect. Thanks for having me. So like he said, my name is Taylor Lusk. I'm a forensic nurse at a multi-facility system in Southwest Virginia. I do forensic nursing as my primary job. I have been an ER nurse. I still currently work on an ambulance as a registered paramedic. So I still have a wealth of knowledge within about almost 13 years of being in the medical field. So I'm very excited to be here and educate on this topic.
Well, we're glad you are. It took us long enough to get you on, but
things happen.
So from your perspective, can you explain what a forensic nurse does in day-to-day practice?
Yeah, my role is I do sexual assaults. I see patients that have been involved in sexual assaults, domestic violences, strangulation. I see pediatric sexual assaults, child physical assaults, any strangulation patient we see. We also see, at the request of law enforcement, any like simple assault and battery. We see a wide range of different things that the normal public knows exist, but doesn't know about the quantity that exists with it.
Sure. I knew about the sexual assaults just from my law enforcement, but I never knew that a forensic nurse took care of like strangulations and stuff like that.
Strangulation is the thing that we're really pushing more recently, just because of it's how silent it can be and how deadly it can be,
Sure.
Just because it requires so much of the medical exam and then different things that go along with it. So we do what we can.
So what does a typical shift look like when you're acting as a forensic nurse?
So for my facility, I am on call. My position is salary, but so I have to be within the hospital within an hour, but as long as there's not somebody that is needing my services, I don't go into the hospital.
Okay.
They call me when they need me. Some nights I could be up because I work mainly night shift. We do 3 12s a week, all on call, and I could be up the entire night or I could sleep the entire night. It just depends on the call volume that we have going on.
Sure. On average, how many of those nights do you get that are busy?
When I say busy, I usually mean like 1 or 2 patients at a time, just because of the in-depth it takes.
Sure.
I don't know if I've been patient bedside with a patient the entire night, but probably out of a whole month, maybe 1 or 2 nights that I'm like the entire night, if
Sure.
that.
That's probably a good thing.
Yes, I like to say that I don't have to go to work, but when I do have to go to work, my job is someone's worst day.
Sure, absolutely. So how is forensic nursing, and you touched on this a little bit, but how is it different than other nursing specialties? Like, say, compared to just a regular ER nurse, like what goes into being a forensic nurse that they don't have to worry about training wise, whatever?
Right. So we have specialized training in trauma-informed care, which I did not receive as an emergency nurse, which I feel like every nurse should take. But it's depending on the specialty, it's hard to take that into your training. So we have trauma-informed care. We are trained in evidence collection for the sexual assaults, medications that we can give during sexual assaults. We're trained in different photography that other nurses are not, to collect, again, evidence that can be used later in court. And we also go to court. So we're trained how to be an expert witness when the time comes if we need it.
You're basically a detective in the hospital setting.
I have, yes. So it's actually forensic is the combination of medical and like law enforcement, and we bridge the gap to it.
Right. So what do forensic nurses specifically just work in the ER, or do they work outside of the ER?
So my department is we're specialized out of the ER. So we work within the ER department, just within our own own little catty corner is what I like to say.
Okay. What kind of education and certifications are required to become a forensic nurse? Like how extensive is the training?
So the training is very extensive. We have to have so many, to start off, we have 40 hours of didactic training, which is like computer based for the sexual assaults for the adolescents and adults, and then another 40 hours for the pediatrics. Okay. And then on top of that, we have to have the court training. We have to observe another forensic nurse for testimony. We have to do pelvic exams because other nurses cannot do that. So we're trained specifically for that. We have to do, we follow law enforcement. We usually follow a detective. We work with victim advocacy here in Southwest Virginia. So we kind of follow them for a day, kind of see what they do. We have to have a certain number of cases in sexual assaults for adults, sexual assaults for pediatrics, and domestic violences. We have to cover all of our bases because we're our position is very, I can't think of the right word, but autonomous. We work very autonomous. So we have to make sure that we're doing everything right. We miss something, it could let somebody go. We collect.
You're handling a chain of evidence.
Yep. Yeah. The chain of evidence. We work very closely with a lot of people. So we have to make sure we know what we're doing.
Gotcha. So how did you personally get into forensic nursing yourself?
So the bottom line is that I went to a couple different nursing schools and never made it through the nursing school. So I ended up having so many credits between different times of schools that I love forensics. So like the CSI and stuff like that. So when I had so many credits, I actually had enough room when I finally finished my bachelor's degree in emergency services that I was able to do 2 minors. So I also have a minor in forensics and a minor in biology.
Okay.
So I was able to, when I did that, one of the opportunities in forensics was an internship. So we had an internship with our local ME office, which was actually I really enjoyed that one. We had an internship with a local forensic nurse, and then an internship with law enforcement. So I completed all 3 when I did my minor degree. The specific job that I got into was right in the middle of COVID. I was a nurse in the ER, and I was getting burned out very quickly. And to be a fairly new nurse was not good. So somebody that I knew that actually works in the department that I'm in now, she's no longer there, but I was messaging her back and forth and asking her about it. And she told me a position was actually opening up. So I just took a leap of faith, and I'm still here 4 years later. So it kind of fell into my lap.
Sure. Are there different subspecialties within forensic nursing, or is it just a coverall? You're a forensic nurse, you know how to do every step of the.
So there's not any more subspecialties. There's the certifications that are not required for my specific position. It just makes us more credible when we come to court. And allows us to do things. It's on an international level, honestly, because that's where my certification comes, is from the International Association of Forensic Nursing.
Okay.
So the SANE A, which is the adult and adolescents, but then there's also a SANE P that I'm probably going to be working towards in the next year. So it just kind of shows that we're really know what we're talking about and we're an expert in it. It's not required, but every case is completely different. So there's no way we know how to do every case the exact same.
Gotcha. What kind of patients do you most often work with? Like, what is adults, children? What do you?
I'd
Experience.
say it's probably 60-40, but the majority are adults that we see. We do see a lot of kids, which does take a toll on you.
Sure.
Because these, again, are probably some of the kids' worst day. Some of them are so young that they don't know what's going on. So, but I'd say more adults than anything.
The kid aspect's very hard. No matter what aspect, no matter what profession you're in, the kid aspect's super hard.
Yeah, especially when you have your own at home, it's hard. Yep.
So, with that being said, how do you balance providing compassionate care while also collecting forensic evidence?
So part of that is the trauma-informed care we take in from the start, as soon as we get the call, until the very end, and whether the end is the end of the exam or court, should it go to court. We have a advocate with us, an emergency advocate, that once we go through what we need to and then we start the exam, we're still doing compassion care, but the advocate also helps us. So we're focused on the evidence during the actual physical exam, and then the advocate helps provide compassion and care because we work hand in hand.
Kind of like a mediator almost.
Yeah. And sometimes when I'm explaining things, my nurse brain, my medical brain doesn't work to dumb it down a little bit, or I guess dumb it down is not the right word, use like layman terms.
Sure.
But that helps a lot because they're able to like understand what we're doing and they're able to explain it a different way.
It would be a very stepping in glass situation.
Yes, you have to choose your words right, and you have to make sure that you are doing the best choice for that patient, whether it's doing something right this second or putting it off for a minute. It just all depends on the case.
So what are some common misconceptions patients have about forensic exams?
Oh, the biggest one is that we can collect evidence and have the data back within like minutes. Like CSI has ruined this. I love CSI, but it has ruined the forensic aspect of it.
It's ruined the whole aspect of law enforcement and
yes,
CMS and everything.
They want us, or we'll get some patients that moms bring in their daughters and want us to do an exam and say, "Is she still a virgin?" No, that's not how this works. But they want the data. They want to tell me if something definite has occurred or has not occurred in sexual assault. And I can't say one way or the other. I'm an individual or an independent. I collect the evidence, I pass it along, and it's either up to the state lab to come back with evidence or law enforcement to do their half. I just like to say I'm one piece of the puzzle.
Sure. So how does your role intersect with the legal system?
So part of it is the collecting of the evidence and then the chain of custody with law enforcement, and we can discuss our findings. We can't say definite one way or the other, but we also have to go to court sometimes to testify on what we found. When we go to court, we're not for the prosecution or for the defense. We are an independent, and we just give the facts, or we can give our opinions if they qualify as an expert witness. So there's different places that it comes in. Yep.
That makes sense. I was curious about that myself, aside from the questions, what side that, if you were on one side or the other.
The majority of the time the prosecution calls us, but sometimes the defense can call us too. So it like I said, we're not one way or the other. We are an independent right in the middle.
What does evidence collection involve, and why is it so important?
So one aspect of evidence that we can do is if we suspect an individual has been drugged, so roofied, the date rape drug. There's multiple other ones, but a lot of people are familiar with the roofies. We can collect blood or urine depending on the time frame to say, yes, this individual was given this medicine or not. We can also, what we do, like a PERT kit, which is a physical evidence recovery kit, or people think of it as a rape kit. That involves a bunch of swabs depending on the individual's history that they've given us, where we can collect possible DNA from. And it just, like I said, depends on the time frame and their history that they've given us. But the majority of it is the swabs of DNA that we can possibly collect from an area.
Sure. What ethical challenges come up in this field for you, if any?
I mean, I wouldn't say they're really challenges for me. I just know that we have different types of individuals that we deal with. The biggest majority that's coming out is individuals that don't identify as the biological sex they were given. So we have trans individuals. We have people that have actually transitioned. So we have male to female or female to male. We, unfortunately, in our position, have to treat the patient with what the biological aspects that they have. But we still try to treat them with respect, whether it's ask them their pronouns or different things that they want, like whether they want different care provided to them based on what they identify as. So I'd say that's the bottom line, but it's really not an ethical problem for me because I treat the patient as a person and not what they identify as.
Sure. So while we're here and while you brought it up, after we talked yesterday, I did pull some questions to ask you about that area of your position on the whole trans aspect. You touched on it just a little bit, but how do you approach caring for transgender patients in a forensic setting?
The same way as I treat a person that's not a trans. Is they're a person, they've had a crime committed against them, and we're going to treat them and do what we can for them.
What language or terminology is most important when working with the transgender patients?
Asking them their pronouns, like what do they prefer to be called? Is there a name that they prefer? Do they prefer non-binary terms? Do they prefer he or she, or her or she if it's a male, or vice versa? Does the female provide he or prefer he or she or her?
Sure.
So it all depends on that's the best thing is we go into this asking what the person prefers and what their stance are, basically.
Being very open.
Yes.
Sure. So are there mental health considerations that are especially important with transgender patients?
I wouldn't say specifically just for trans. I would say it's overall individual. These people get taken advantage of. It's not this person was wearing a skirt too short or too revealing. This was a crime of opportunity and they got taken advantage of.
Sure.
So we do what we can for what we can at the time.
What challenges do you see in the system when supporting transgender patients?
The lack of resources. It's very hard. I know our advocacy center that we use in Southwest Virginia with my specific department, they do what they can, but there's not a lot of resources. So if we do a domestic violence, one of our resources that we do is a danger assessment. Unfortunately, right now, it's only based off a female victim with a male perpetrator.
Really?
So we don't have the resources to do a danger assessment for a male victim. Excuse me.
You're fine.
For a male victim that's been assaulted by a female, or transgender patients, a male versus transgender or female versus transgender. We don't have resources for that. And I'm hoping in the future we do, but for right now it's limited.
I was going to say, is that something that is evolving, or?
I honestly don't know, because the a lot of the departments around us don't use the danger assessment because there is a tool for law enforcement that can do a danger, like an abbreviated danger assessment. I don't know what it's called for law enforcement, but they do an abbreviated danger assessment out in the field, whether the patient wants to come see us or not. I think it's still something that everybody should have some education on to
Sure.
kind of, it's another tool in the toolbox, I like to say. We can't force patients to leave
Sure.
the situation.
Right.
But we can give them a tool in the toolbox to kind of say, hey, here's something to keep out for. Here's something to like open your eyes about. Like, here's some evidence.
That seems to be a trend that I'm catching on to after I do more and more of these, is just the amount of resources and education that are out there for law enforcement, EMS, to be able to provide people with the knowledge or help that should be out there to be given.
Yeah.
And, law enforcement is probably the least knowledgeable about it. But that's not just with like transgender, it's with children that are autistic, or have other health issues. That's something that we didn't really receive.
Right.
I got a little bit of it from, my EMS time, but unless you're specifically using your in-service hours to take a class like that, you're not getting it.
Yeah.
So I would like to see that evolve, just because law enforcement in the face of a child with autism doesn't normally go the greatest, because they don't know how to handle them.
Yeah, and especially in my position, if we have victims that are patients that come in to see us, we have autistic patients and patients that have different specialties that are needing specialized care for the forensic aspect. And we recently, in my department, have got training on different tools that we can use to kind of help the autistic patient through, or the neurodivergent patient, which some of them, they don't always work for every patient, but like I said, it's another tool in the toolbox that we can use. And even in EMS, it's hard to take care of these patients because you spend so little time with them.
Right.
It's hard to get what they need on their level. And I'll tell you, I'm more leery of working with those patients only because I don't know how to care for them.
Sure.
It takes years to kind of get what they need. And sometimes the perpetrators are their parents, and those are the ones that we deal with. So how do you take care of this patient that has specialized needs and you don't have the person that's specialized in this patient?
It's a tricky field all the way around.
Yes.
So what advice would you give another forensic nurse or nurses encountering transgender patients for the first time?
Leave your own biases at the door. You're treating this patient like a person, not what they identify as. And that was something very hard for me to learn based on my own, I guess, thinking, because this is still evolving every day that things come out. And like I said, it's a crime of opportunity. So we don't deal with these patients a lot because they come in, they're very scared. They're like, well, how is this other person going to treat me if this person just treated me completely different? Like, it takes a lot to trust us, especially in such a vulnerable state that we have to deal with after what has happened and what we actually have to go through to get the evidence if that's what they decide to do.
Sure. How can forensic nurses improve their cultural competency and understanding in these cases?
Any trainings that whether your system provides or the public, or, if you deal with somebody, outright say, I'm like, I don't have a lot of training in this. I don't have a lot of experience. What can I do to help you? Here's the list of things I can do. What can you just learn from your patient? Like, they're not scared. They'll tell you that as long as you have an open mind and you want to learn from them, they're more than happy to educate you.
How do you navigate situations where patients have had prior negative experience with healthcare providers in the transgender role?
That is very hard because they categorize you into all the same patients. The best thing you can do is just treat them like they're a person and say, I'm sorry you've had past experiences. I'm going to do my best not to do wrong by you. So here's what we're going to do. And then leave it up to them. If they've had bad experiences, there's nothing you can do to change it without just showing them.
Sure. Are there unique documentation or identification considerations when working with transgender patients?
The documentation, I would say, is the same for everybody across the board. The only identification is, again, the way you call them. What do they want to be called? Do they want to be called a different name? Do they want different pronouns? There's really not much different. A patient is a patient is a patient in my department.
Yeah. That's what I expected.
Yeah. We do our best what we can.
But it's such a controversial topic right now.
It is.
That not a lot of people understand. And, we spoke a little bit about it yesterday. But in the world that we live in, it is undoubtedly a scenario that we're going to face.
Yep.
So
it's hard.
It's either be uneducated and behind the ball, or be educated and try to help the situation.
And you tell somebody like, look, I'm really sorry. This is a first for me, or I don't have much experience. What can you teach me? And we learn from our patients at the same time as they're learning from us, as we provide the education or we provide whatever services we can for them.
Let's see. In your experience, are transgender patients more likely to face substance use challenges compared to other populations in forensic settings?
So without thinking like too hard into this or like data numbers, I would say no. I think that they are just as equal as other victims because that's it. They're victims. Like I said, it's a crime of opportunity. So it just all depends on the support that they have, the support system to get through this event that has occurred to them. And whether they have the opportunity presents itself to actually get a hold of anything. I think it all depends because these mental health patients that we see, the mental health in these patients it's bad. And that's part of the aspect that we have to deal with and part of the tools that we can pull out of our toolbox to give them the education or the services like afterwards, like counseling and stuff like that. So we do what we can and we provide them with the tools. It just depends on how the patient wants to proceed.
Sure. So switching away from that topic, how does working in forensic nursing affect your mental and emotional health?
It can take a toll. When I first started, I had a young child at home. She was 6 months when I first started in forensics. So seeing some of my baby patients and the younger patients was hard. I would want to just come home and just hold her and cry because I don't understand how people could do this to children. One of the most vulnerable populations, and it's hard. One of my mental health aspects that I take care of is I go to the gym. I work out my frustrations. Unfortunately, when I leave the hospital, I try to leave everything at the hospital until it's time to come back to it, whether it's charting, court, unless I have to, I try to compartmentalize. And I think that's how I deal with most things.
So you kind of answered that. What coping strategies have you found most helpful in managing stress from the job?
Yeah, the compartmentalize is the best thing for me. And then going to the gym and just spending some time for myself, spending time with my family and like really focusing on my family time. When it's just me and my child or me and my husband, I I really like try to focus on the moment and take it in and realize that other people don't have as good as I do. And I do the best I can.
Sure. How do you personally recognize when you need to step back or ask for support?
When I feel like I've gotten, like, whether a case has been too much for me to handle. I have my team that I work with. We bounce ideas off of people. If I need to, we have employee support through my department or my facility. My company, they provide help or counseling or therapy, whatever you want to call it. But I really try to do my best to just maintain this patient and then move along as needed.
So with that being said, are mental health resources for forensic nurses or nurses period improving in your experience from what they have been?
I'd say there's a push for it. I don't know if it's improving because I have not yet, knock on wood, had to use it.
Sure.
I feel like what I'm able to do on my own is helping. I know that there are some cases in the ER in forensics that just get to somebody a certain way. And they have the resources there. I can't really answer if it's improved
Sure.
because I've never used it, which is a good thing.
I would agree. But with that, so would you say, is there a stigma around mental health in healthcare or the forensic setting, or is it kind of openly discussed, or is it an open thing?
There's definitely a stigma, I think, just like with any like law enforcement, EMS, like anything that we deal with a lot. It's like the stigma is this is what you signed up for, suck it up and get over it. But people have to realize that we're human too, and it's hard to do what we do. Because I mean, like I said, when I get called into work, it's somebody's worst day. So it's hard to have to relive through things if you don't find a healthy way to cope with it. It just all falls. It's individualized. You have to be able to recognize the signs, and then, like I said, I have my team behind me. So if something is getting to be too much, whether it's the work-life balance, something at home is affecting my patient care, we ask for help. Our first line is our team, and then we continue on from there, whether what we need, what resources we need.
So how can healthcare systems do better at supporting mental health of forensic nurses or nurses, period?
I think be more open to the situations that we go through. I think a lot of it is that they don't see it firsthand, like the other sides of it, the people that are not knee deep in what's going on or seeing everything firsthand. It's hard to think how it's going to affect a person. So besides like the therapy, I think we just need more like different resources because sometimes a lot of people are afraid to ask for help, and it's like
why do you think that people are afraid to ask for help? This is a question that is not on my script here, and I say that I go unscripted, but I write out scripts all the time. But I had this question asked to me by somebody a while back off camera, and I can only answer it from a law enforcement perspective, but I answered it as, well, you answer it and then I'll tell you how I answer it.
I think people are afraid to because we are seen as the helpers, not the people that need the help. So they're like, I know in the ER, one of the aspects is, oh, you see this every day. It's fine. You'll just get over it.
Yep.
Well, maybe that one patient, but as you continue on, it's hard. My husband and I talk about a lot when I was in the ER. What would you do if you had a individual that came in as a patient but tried to harm law enforcement? And that would be hard. I But bottom line is I would treat everybody the same. A patient is a patient. What they did outside of my ER or my room is something completely that I don't need to deal with, and it's completely different. It comes to the bottom line is a person is a person. It doesn't matter what. There are some really not nice people out there, and that's what I deal with is the fallout from the not nice people. But when you continuously see the same thing over and over, it takes a toll. Or if it hits home, like when I first started, the kids really hit home. Sure. If you don't have a way to take care of it, you're not going to get it taken care of, and it's going to weigh on you. Sure. You're going to find unhealthy ways to cope with it, and that doesn't help at all. So I think in general, the mental health system in America could be better. We always say, check on somebody. You never know what's going on. Until that person wants help, you can't help them.
Absolutely. So I answer it not much different, but, as EMS, law enforcement, firefighters, we're expected to be okay and to go from one call and go straight into another one, whether that be cutting somebody out of a car that just got mangled up or a child that has been sexually assaulted. And you have to be okay to mentally take that on and also not take it home and compare it to your own situation. And I think that's where a lot of people get the whole, we don't ask for help.
Yeah. And
because how can we ask for help when we're supposed to be okay? And then let's say somebody sees that and they don't trust us anymore because we're not okay.
Yeah. And that's part of it is you can't help somebody who doesn't want the help.
Sure.
So if something is weighing on you, you have to ask for the help. Like I know, like when a lot of suicides come up, a lot of people are like, well, we should have seen it. They should have asked for help. Well, maybe that person didn't want the help. There's nothing you can do about it if they didn't want the help, if they didn't recognize it was a problem. And then this is the end of it. It's just it.
That's the hard reality of it is if somebody doesn't want help, they're not going to take it. Like you're not going to make any headway with it.
Yep.
And that's a wrap for today's episode of the Quadcast.
Remember, breaking stigma doesn't stop when the episode ends. We're building a movement, and you're a part of it. Stay strong, stay aware, and stay connected.
And this is the Quadcast signing out.